Hello and welcome to another episode of the Nurse Betsy Show. This is our podcast here at 1199 SEIU, Florida. We welcome all of our nurses across the state. Anyone else who chooses to listen, we say welcome, good morning, good afternoon, or good evening, whatever time that you choose to watch or hear this podcast. I am now going to turn it over to Nurse Betsy and the rest of our team. This has been DeQuasia Canales, one of our vice presidents here in the Florida region.
Thank you, DeQuasia, and great to be back. And we have very special guest tonight, my great nurse union leaders and friends, Nora Duncan, who's an LPN, and Pat Diaz, who's an RN. They are a major reason that we have such a good union in South Florida. They work in, and I've worked in hospitals in South Florida, and our delegates, Pat served on the 1199 overall executive council. They have bargain contracts, many contracts. They have represented the people they work with and stood up for safety standards, especially in the last couple of years with COVID. I was just saying to them, I can't imagine working in a hospital with COVID without nurses like them constantly monitoring and intervening and making sure that all the healthcare workers were protected, that the policies were implemented. They are just amazing nurse leaders because they just don't stop. And safety and staffing has been their biggest initiatives, and they manage to still be great nurses and advocates for their patients. And so welcome, Pat and Nora. And we were going to talk about nurse retention, which is a big issue, and things that are affecting it, such as recently we've had in the news this nurse that was convicted and how that affects retention and the concept of just culture. And so I was just going to read a couple things that I found before we start. And there's a report from, it's called Nursing Solutions. I believe it's like a nursing employment agency national that helps connect nurses with hospitals. And it's the cost of nurse turnover. And this was in October of 2021. So it's pretty recent. And what they reported was since 2016, the average hospital turned over about 90% of its workforce and 83% of its RN staff. So that's just really shocking. And the average cost of turnover for a bedside RN is ranges up to $52,000, which causing a hospital to lose 3.6 million to 6.5 million per year. And they said each % change in turnover rate cost or saves the average hospital $271,000 a year. So that's a lot of money we're talking about. And what they don't talk about is the loss of experience. And I think you two can really talk about that. Pat, you want to talk about what's going on and why nurses are leaving or turning over? Or...
Well, good afternoon, good evening, good night. What I see happening is that the more experienced nurses aren't being valued because they can get a younger version for less money, and they do as they're told. Basically, the problem, there's many problems, but one in particular that I have experienced is that you get inexperienced nurses in new nurses and no one's following up to see that, to make sure that they're doing the right things. So it's like bad nursing get passed along, and everybody is a victim as far as that is concerned, because the new nurse that don't know what she don't know, and then the patients that are receiving that care. So I mean, I think what they need to do is to make sure that they value the experienced nurses. There are roles that the experienced nurses can play that would help the nursing profession altogether. I mean, if we were to be able to have like a resource session that the younger nurses can come to with questions, or can be evaluated on a certain frequency to make sure that that the care is being delivered, because it's no bad intention on their part, it's just they don't know.
Exactly. Nora, I think we lost your video here. Um, but Nora, I know you work, there you are. I know you work with monitor, you work as a monitor tech and with a lot of telemetry. And what happens when you call nurses that don't have the experience that they should with arrhythmias or problems?
They don't understand the urgency. When I call and I say, for instance, like a patient had a run of VTAC, that okay, I'm with the patient, but that's not the answer that I need. That's not, you don't see what I see. I'm trying to explain the urgency of what I'm trying to tell them. Lots of times if you call and say the patient's off, okay. But then, it's minutes, and minutes matter. It can be several minutes before the patient's actually put back on the monitor. And sometimes they don't understand the urgency. Especially at the change of shifts.
Okay.
People, so many things happen at the change of shift. And when I call and say the patient's off, well, I'm getting a report, that is the wrong answer. Because
and then of course,
so many people.
Oh, I was just going to say that's I think Joint Commission everybody has identified that change of shift as one of the most dangerous times for a patient.
Most dangerous times, and lots of times it's just that they don't understand the urgency. A lot of them don't understand arrhythmias. A lot of I don't understand how they get there. When they don't understand, I try as best I can to explain. In the little time that I have, but a lot of them don't know. A lot of them don't know.
And we have a lot of new nurses coming out of schools now who didn't get the benefit of any real clinical experience, hands-on clinical experience because of COVID.
Exactly.
And so oh, go ahead.
I'm sorry. And the other thing is, during COVID, at least at my hospital, they just worked certain floors to death. Those nurses were tired. They weren't valued. They weren't, and a lot of them, most of them left because there's no, they weren't valued. They weren't valued.
And so no one said as they're leaving, what will it take to keep you to stay?
No, nobody says anything. It's as if they have this whole storage of nurses that they can just pull from. It's that I call it stoutness. They don't ask why. They don't. It's like they don't want to know why.
And
They
so
don't
when
want
we
to.
end up with not enough nurses,
It's
and
dangerous.
they're coming up with answers, right? Of the alternative of let's get a lot of people in here that aren't trained, that don't even have what the new nurses have. Um, let's bring in students, let's bring in, you know, and how do you see that as impacting the the kind of care?
I think that's worse. I think that's worse because I have not at my hospital. I've seen several nurse externs. The nurse externs. I've seen
Which is a
several of
nursing
them
student,
hired.
right?
Yes, it's a nursing student, and I mean that's good, but not to replace
Mhm.
what you don't have. You can't replace a nurse with a student because they're there to learn and I mean and to help in the way they can, but that's not exactly what we need. You need experienced nurses. You need those.
Now for
It's just not.
now for years, I know people my age, nurses my age, like the baby boomers, on the end of the baby boomers. We had this big bubble of nurses, um, and we saw it coming that all these nurses were getting near retirement age.
Mhm.
And as far as I could see, nothing really has. They kind of ignored it, right?
Exactly.
And
Exactly.
then COVID hit, and a lot of retirement age people, nurses, were high risk,
Yes.
and there's no like one of the things for retention that I would do if they asked me, they don't. Um, why does maybe there should be things if you're a senior nurse, maybe they don't float you everywhere, right? Or maybe you can do half a shift instead of a full shift, job sharing, um,
Yeah.
more part-time or per diem shifts, or there's a lot of just getting safe patient handling equipment, because
Yeah.
I know if you go to work now, they make you sign a thing that says you can hold what, 25 pounds in front of
20,
you
I
for
think it's
2 hours or something. You can be on your knees for 8 hours.
It's 50 pounds.
Oh, it's 50 pounds.
Mhm.
So no accommodation to extend the careers of the nurses, other than promotion into management, but that's not always an option. Or
Right.
and
Right.
so what do you like, Pat? What would be important to you to retain you and to keep you working? And
To make it possible for me to work where I'm not in pain. Because basically I worked myself off foot. I mean,
Mhm.
um, and this is the thing I had been battling with because my mind is fine.
Mhm.
I feel like can still continue nursing, but I can't walk up and down the hall anymore.
mhm,
And I think it's like I just feel like move over, time for us to replace you with somebody new. And and that I'm okay with that, but at least let me share my experience with them,
mhm,
because nursing is not just about book knowledge, it's about experience. And every day I learn something. I
Mhm.
mean, I've been a nurse for a long time, but I learn something every day. Even now, I'm not in a hospital right now. you know, it's like I find out things. As a patient, I learn things, but
Mhm.
you know, it's I just I feel bad for the younger nurses because I was put to ease
Oops, you're a little
because
frozen.
I had someone
Hmm.
I can go to and say, you know, hey, am I doing the right thing or what should I do for this? You know, someone I can bounce it off of, and that may put me at ease. These girls don't have that because 2 years you're in charge. And what experience do you have? You know,
If
it's
it's two
like
years, if it's 2 years, it's
if
not two
it's two
years.
years, you're
In my,
true. They're
yeah.
training at 1 year, they're precepting other new nurses.
Hmm. Hmm.
The example I have as a patient, I was in the hospital getting Lovenox, and um all the nurses were giving me Lovenox and um pushing the air out of the needle. So I
Hmm.
didn't know, you know, at first I was out of it, so I really didn't know what was going on. But when I started feeling better, you know, I'm looking at this nurse and she's like doing something. I'm like, what is she doing? And then she's like, oh,
Hmm.
okay, I'm ready now. I said, did you just push the air out the needle? She said, yes. I said, you're not supposed to do that.
Supposed to do
She's
that.
like,
No.
yes, you're supposed to prime. I said, not with Lovenox. So she said, well, I was, I said, don't take my word, pick it up. I said, but I would appreciate, you know, you get another needle. So she said, oh, no problem. And then she got another one. And in that I was paying attention, majority of them was doing the same thing.
Hmm.
So one day, I'm gonna be quick. One day, a nurse came in and I was talking to her about it because she was about to give me Lovenox. And she said, yeah, she said, I do most of the precepting. She said, and that's what we were taught to get the air out. I said, oh,
Hmm.
I said, no. I said, you need to look it up. Call the pharmacy if you need to, but you're not supposed to expel the air from the Lovenox. So
No.
she's like, oh, I didn't know she had a student with her and she had a new nurse that she was training. And
Oh
they're
my
all
gosh.
saying, oh, really? So on my exit, when I was talking to the case manager, they asked me, you know, I said, you guys need to follow up. You have to make sure that whoever's precepting your new employees are telling them the right thing because nobody's coming behind. And that is a role
Mhm.
an experienced nurse can fill because they can be the one to maybe after the orientation period that they can, you know, do follow-ups with these new nurses. And that wouldn't require any too much physical labor, you know? And
Yeah, and I
it
remember
would
my
be
first job at night. They had a resource nurse
yeah.
because we were all right out of school. It wasn't great. But you could call her if you didn't know what you were doing. And she was an experienced nurse, and it was a big city hospital. She had a lot of floors, but I remember calling her. Um, she responded to emergencies because she could help us out because a lot of us didn't know what we were doing. Um, but what I was thinking of is, and I'm talking in addition to retention, that what this report also talks about, the newer nurses are moving faster, they're leaving faster than the older
Yeah.
nurses. Because coming into nursing now, and it shouldn't be like this, um, you can't make a mistake, can you?
Oh,
They
I'm
also
telling you.
didn't sign on for the type of labor that they get because, you know, in school you get 3, 4 patients
Mm-hmm.
and, you know, you get all the help you need. You get out there and being employed, you're getting 8 patients
Mm,
and, you know, it's a long day.
it sure is.
Hmm.
And I'm thinking of when I came out of school, we had not a lot of charting. Um, Nobody had a GPS locator on me because it didn't
Mm,
exist. Nothing was electronic, and you know, it's good we have all these safety things now, but they all take time.
Yes.
And so everything's recorded. There's cameras in the ceilings. Everything is watched. And, you know, if you don't get the medications out in the time allotted, you know, officially, right? That's a medication error. But I don't know how you give medications to 8 patients at the same time. They haven't figured that out yet.
And answer the call light and take them to the bathroom all at the same time.
Um, so the thing I wanted to get into was years ago, very quickly, years ago, study came out, was in 2000. We were killing 100,000 people a year with healthcare. It was called To Err Is Human, Building a Safer Healthcare System. And they came up with this idea of, with many different ideas that were implemented, of just culture. And just culture means that most errors are a system problem that a human gets involved in, right? And healthcare is a very complex system. There can be 20 steps just to do one thing. And so that's what brings us to this nurse, Redonda Vaught, who got convicted in Nashville for a medication error, which unfortunately, horribly caused a patient's death. She fully disclosed. She told everybody. Initially, the Board of Nursing had no action against her. The hospital did not report it to the medical examiner. And that's what I think tipped off things going. But one thing is that hospitals through root cause analysis, if they have a safety program, are allowed anonymity, even in patient death, because the idea is if we can't report errors, we don't know how to fix them. And the aviation industry does this, and they are the safest high-tech industry in the world. And so, what I wanted to ask you about is your thoughts on this nurse. CMS, Center for Medicare Services, cited the hospital on several safety violations, safety problems and practices involved in this incident. No one from that hospital has been charged, just the nurse. And I also saw that the hospital did not participate in her defense. And so she was on her own. So Nora, maybe you want to comment on this?
Absolutely, because I have a case, I have a grievance right now. We're going to the step 3 tomorrow. Not that the patient died, but that somebody made a mistake. Somebody, and the thing is, when somebody makes a mistake, you don't throw the book at them. And that's what happened in this case. They threw the book at this young man. He's an excellent nurse. Nothing in his personnel file, nothing. But yet they did everything to him. It doesn't have to be that way. It doesn't have to be that.
Actually, what does this teach the other nurses or people or healthcare workers?
If you make a mistake, keep it a secret. Don't tell anybody, because if you do, you're going to be in trouble. And that's the message we don't want them to have.
Right.
That's not the message we want to see.
And so now we're not only thinking about nurses are thinking about getting disciplined or losing our jobs or getting suspended. We're thinking about ending up in jail.
Exactly.
And so, Pat, what are your thoughts on this?
My feeling is that it needs to be a teaching moment. Before, it was always a teaching moment when there's an error, because it encourages you to report it. Not only because it may not be just my mistake. It may be something wrong in the pharmacy. It may be something wrong with the way the doctor wrote the prescription. It may, I mean, you never know. It's just
Mhm.
you do need to do like a root cause analysis to find out why is this mistake happening. And if you're gonna throw me in jail and I'm gonna lose my license, I mean, what's in it for me to report it, because that's the end of my career. You know what I'm saying?
Mhm.
And unfortunate, the patient suffers from it because you won't learn what to do for the next patient.
Exactly,
Yeah.
exactly. And no one wants to make a mistake,
No,
but,
Nobody intends to make a mistake. No.
but we're
but,
human.
yes. And there's a lot of factors like fatigue and long shifts and not getting breaks and staffing. And
Distraction
so,
altogether, because I mean, like I said, passing meds at a certain time and you have to answer a call late, the patient asks to go to the bathroom, something to eat or whatever, you have to stop what you're doing to go and take care of it, otherwise you're reprimanded for it. So I mean, there's a lot of distractions and you have to be able to function and not make a mistake.
right.
That's very difficult.
It
And
is.
so
It is.
we all want to, practice safely. So we have to wrap up because we're getting long here, but I've really enjoyed this. But I just wanted to hear your ideas on this because it seems to be it has brought forward a lot of nursing issues, and we've seen what I think is good. We've seen a lot of nurses are supporting this nurse who um, no intention to hurt anybody. And I know personally I've made errors, and you just feel devastated when you do, even though it's something maybe out of your control. And so
Yes.
I know that's what the two of you are always promoting and fighting for and standing up for, is how can we make this safer for both
Exactly.
the staff and our patients, because they're, you know, linked together. And so thank you for taking your time out to do this. And thank
Thank
you
you,
for
but
all you do, because every time I ask you guys to do, you're there. And and you know, I know you're working
no
both at the
problem.
hospitals and holding up everything for our members, and also helping to build this union in South Florida. Not the easiest state to be a union member in, but thank you again for everything you do. You are my heroes, and and just wonderful to have you. Thanks.
Thank you. Thank you, Betsy.
Duquesha,
Back at you, Betsy.
thanks.
So if you're listening to this podcast, or if you found this podcast on our website, we encourage you to stay tuned with us, stay in contact with Betsy, check out the resources that you find next to the links for the Nurse Betsy Show. We look forward to working with you, advocating for change in our facilities as well as in our community. Again, we hope that you all have a good morning, a good afternoon, or a good night.